Hello, I'm Dr. Wilson Tsai. I am the director of the Heartburn Center of California. Today, I'd like to speak about why some patients may actually feel heartburn, or what we know as GERD, gastroesophageal reflux disease. It's a common misconception that GERD is caused by a chemical imbalance of stomach acids causing reflux or heartburn symptoms. Unfortunately, what many patients don't understand is that there's supposed to be acid in your stomach. And simply by taking medications which decreases the acidity of the stomach contents does not mean that heartburn and reflux is not happening. It's very similar to a patient having chest pain from a heart attack, where a physician just gives them a morphine tablet to stop the chest pain without understanding the true anatomical causes of what we call angina, which is chest pain from a heart attack. In many patients with heartburn, the body is trying to tell you something, and that is something is probably wrong. When you medicate a patient for symptom relief only, you may not be determining what we call etiology or cause of the symptoms. Most patients in America, the cause of reflux and heartburn is by an anatomical problem. That anatomical problem is called a hiatal hernia. What a hiatal hernia is where this hole in the diaphragm, which usually accommodates the esophagus to pass through the diaphragm and into the abdominal cavity, that hole in the diaphragm gets split open or widened. And when that hole in the diaphragm gets widened, part of the stomach then pushes up or herniates into the chest cavity. When the stomach herniates up in the chest cavity, that is what is commonly known as a hiatal hernia. The problem with hiatal hernias is, besides the fact that the stomach has now protruded into the chest cavity, it actually causes a dysfunction of the valve between your stomach and your esophagus. That valve is commonly known as the lower esophageal sphincter. The reason why that's very important to understand is because now that there's a dysfunction of the valve, what is happening, it is allowing the contents of the stomach to go backwards and damage and injure the part of the esophagus that we know as the distal esophagus. The reason why this becomes very dangerous in some patients is the fact that that chronic exposure of contents of the stomach may lead to esophageal cancer. Esophageal cancer is now the fastest growing cancer in the Western Hemisphere, over a 600% increase over the past 30 years. One common misconception is that the acid is what causes esophageal cancer. Unfortunately, there's been many studies that has proven that it's not the acid that causes esophageal cancer, it's the presence of bile, which is found in about 65% of patients in the stomach contents. And what happens is when patients take the medication to deacidify the stomach, they no longer feel heartburn. But although they don't feel the heartburn symptoms anymore, the regurgitation of the stomach contents, which include the bile, is now bathing and exposing that part of the esophagus to what we know can cause esophageal cancer. Here at the Heartburn Center of California, we recommend that a patient who has symptoms that are uncontrollable of heartburn reflux be evaluated properly. And that evaluation includes an endoscopy and a biopsy of the lower esophagus to make sure there are no cancer cells, make sure there are no precancerous cells that we commonly call Barrett's esophagus. We thank you for your time today and listening about how anatomical changes can actually lead to heartburn and reflux and expose us to a higher risk of developing esophageal cancer. Thank you very much.